All right, good afternoon, colleagues. My name is Charles Hamilton. I am a national diplomatist, and I welcome you to my lightning talk on climate injustice, global inequity, and academic publications and knowledge translation to address climate change and health issues among Caribbean cities. Now, I'm sure that I'm speaking to the choir here. We contribute the least to climate change, but we suffer the most from its devastating health impacts. Now, as a person that operates within the climate change and health sphere, I thought it was important to get a good pulse on the focus and the amount of peer-reviewed research coming out of the region, because one, it could influence the speed and the scope of adaptation initiatives occurring in our region. And moreover, peer-reviewed research is utilized in shaping global narratives and recommendations out of key reports, such as the IPCC assessment reports. And it's important that our region's voice is heard loud and clear in these types of initiatives. So this is how come I set off with doing the following objectives: identifying, extracting, and analyzing scientific literature on national adaptations for climate change and public health among Caribbean cities. I tried to identify the focus of those initiatives through the lens of the IPCC climate change and health risks. I then began to try and compare a little bit the output and focus of those initiatives compared to some of our global North counterparts. And moreover, I tried to provide some conclusions and recommendations for next steps to advance peer-reviewed research on this topic in the region. In the selection of the academic literature, I utilized three main databases: PubMed, Scopus, and Web of Science. I also identified 6 key search terms, with wildcards also being done in order to ensure that I could capture as many papers as possible. I reviewed abstracts and I included them in this particular review if they were in English. They focused on the region. They clearly identified risks posed to human health by climate change. They were published before March 20th. 2019. And also I looked at similar articles and related documents referred to me by PubMed, Scopus, and Web of Science. I then presented this data with 4 key categories: trends, geographic focus, IPCC climate change and health impacts, and study protocol. So what's the first trend? Over a 15-year period, I can only identify 10 academic papers. That's less than 1 paper published per year. That's a pretty poor publication cycle. Furthermore, when we look at the geographic focus of the publications regarding Caribbean cities, basically 70% of the papers had a bilateral or a multilateral focus, meaning that sharing resources, et cetera, to be able to conduct this type of research. Furthermore, the majority of the public health risks identified by the publications were infectious diseases or multi-health issues. And furthermore, 60% of the publications either focused on epidemiological or vulnerability and adaptation assessments. So what does this mean at the end of the day? The results show that there is a limited amount of peer-reviewed research being published on Caribbean cities about the issue of national adaptation to climate change and public health, compared to just one OECD paper that I was able to find that identified 50+ academic publications related to climate change and health. It's clear that we need to prioritize and expand research, perhaps through twinning partnerships, with South-South collaboration within the Caribbean, or North-South collaboration with OECD and global North countries. We should also be looking at trying to leverage ongoing health and climate change initiatives for research, such as the several health national adaptation plans that are being conducted via the EU CARIFORUM partnership with PAHO. We should also be looking for increased synergies and collaboration between ministries of health, tourism, education, and finance, because all of these ministries play a key role to the wealth and health of our nation. And we need to be able to ensure that we're making evidence-based policy decisions by having these ministries support academic publications. And finally, we need to prioritize the submission of projects and initiatives to climate financing bodies such as JEF, the GCF, and OECD countries to advance groundwork and capacity building initiatives within the region. I look forward to any other information or question that you may have on my research, and thank you for joining my lightning discussion.